What if your body had been trying to warn you about diabetes, but the signs were so subtle that you didn't recognize them? Diabetes is one of the fastest growing health conditions in the world today. Millions of people are living with it, and many do not realize they have it until the disease has already progressed. The reason is simple. In its early stages, diabetes often develops quietly. Blood sugar levels gradually begin to rise, but the changes inside the body may not cause dramatic symptoms at first. Instead, the body often sends small signals, subtle changes that can easily be mistaken for everyday problems such as stress, fatigue, or dehydration. But recognizing these early signs can be incredibly important. When diabetes is detected early, people have a much better chance of managing blood sugar levels and preventing serious complications that can affect the heart, kidneys, nerves, eyes, and other organs. Today we're going to explore 10 early warning signs of diabetes that many people overlook. Understanding these signals can help you become more aware of your body and recognize when something might need closer attention. Let's begin with one of the most common early symptoms: frequent urination. Many people with rising blood sugar levels notice that they need to urinate more often than usual. This symptom is known as polyuria. When blood sugar becomes elevated, the kidneys work harder to remove excess glucose from the bloodstream. In order to eliminate this extra sugar, the kidneys produce more urine. As a result, people may find themselves visiting the bathroom much more frequently, especially during the night. Some people may wake up multiple times while sleeping because of the need to urinate. While frequent urination can have many causes, persistent changes in urination patterns may sometimes indicate that blood sugar levels are increasing. Another early warning sign of diabetes is excessive thirst. This symptom is known as polydipsia. When the body loses more fluid through increased urination, it becomes dehydrated. In response, the brain signals the body to drink more fluids. People may feel unusually thirsty throughout the day, even after drinking water. This thirst can feel difficult to satisfy because the body continues losing fluid through frequent urination. Many people assume they are simply dehydrated or that the weather is making them thirsty. However, persistent thirst combined with frequent urination can sometimes indicate elevated blood sugar levels. Another common early sign of diabetes is increased hunger. This condition is known as polyphagia. Normally, when we eat food, the body converts carbohydrates into glucose, which enters the bloodstream and provides energy for cells. Insulin, a hormone produced by the pancreas, helps move glucose from the bloodstream into cells so that it can be used for energy. However, when diabetes begins to develop, this process becomes disrupted. In type 2 diabetes, the body becomes resistant to insulin. Even though glucose is present in the bloodstream, cells cannot use it effectively. As a result, the body believes it is not receiving enough energy. This triggers increased hunger, even shortly after eating a meal. People may feel the need to eat more frequently, or may crave carbohydrates and sugary foods. Another early sign of diabetes is unexplained fatigue. When glucose cannot enter cells efficiently, the body's energy supply becomes limited. Even though blood sugar levels may be high, the cells that need energy cannot access it properly. As a result, people may feel constantly tired or drained. This fatigue can feel different from normal tiredness. People may struggle to concentrate, feel mentally sluggish, or lack motivation for everyday tasks. Because fatigue is such a common symptom in modern life, many people overlook it as a warning sign. However, persistent exhaustion without a clear cause may sometimes reflect metabolic changes inside the body. Another early symptom that may appear is blurred vision. High blood sugar levels can affect the small blood vessels that supply the eyes. When glucose levels rise, fluid may be pulled into the lenses of the eyes. This can change the shape of the lens and temporarily affect the ability to focus clearly. People may notice that their vision becomes blurry, or that it takes longer for their eyes to adjust when reading or focusing on objects. These changes may come and go depending on fluctuations in blood sugar levels. Because blurred vision can have many causes, people often attribute it to eye strain, fatigue, or aging. However, changes in vision can sometimes be an early signal that blood sugar levels are elevated. Another warning sign that may appear is slow healing of wounds. The body relies on healthy blood circulation and proper immune function to repair damaged tissue. Elevated blood sugar levels can interfere with both of these processes. High glucose levels can damage blood vessels and reduce circulation to certain areas of the body. This reduced circulation limits the delivery of oxygen and nutrients needed for healing. At the same time, high blood sugar can weaken the immune system, making it harder for the body to fight infection. As a result, cuts, scrapes, or minor injuries may take longer than usual to heal. People may notice that small wounds remain red or irritated for extended periods. Another early sign that may appear when blood sugar levels begin rising is frequent infections. Elevated glucose levels can weaken the immune system and make it easier for bacteria and fungi to grow. Sugar in the bloodstream can also create an environment that encourages the growth of certain microorganisms. As a result, people with early diabetes may experience infections more frequently than usual. Common examples include skin infections, gum infections, and urinary tract infections. Women may also experience recurrent yeast infections. Because these infections may seem minor or temporary, people often treat them individually without considering that an underlying metabolic condition might be contributing to the problem. However, repeated infections may sometimes signal that blood sugar levels are affecting the body's ability to fight harmful microorganisms. Another symptom that may appear is tingling or numbness in the hands and feet. This condition is sometimes called diabetic neuropathy when it occurs in people with diabetes. High blood sugar can damage nerves over time, particularly in the extremities such as the fingers, toes, and feet. People may notice sensations such as tingling, burning, numbness, or unusual sensitivity in these areas. In the early stages, these sensations may come and go. Some people may feel mild discomfort or a pins and needles sensation, especially at night. Because these symptoms can be subtle, many people dismiss them as circulation problems or fatigue. But persistent tingling or numbness may sometimes indicate that elevated blood sugar is affecting nerve health. Another early sign that may appear is darkened patches of skin. This condition is called acanthosis nigricans. It often appears as thick, darkened areas of skin with a velvety texture. These patches commonly develop on the neck, armpits, elbows, knees, or groin. Acanthosis nigricans is strongly associated with insulin resistance. When the body becomes resistant to insulin, the pancreas produces higher levels of this hormone in an attempt to control blood sugar. Elevated insulin levels can stimulate skin cells to grow more rapidly, leading to the darkened appearance seen in these patches. Although these skin changes are not harmful by themselves, they can sometimes serve as an early warning sign of metabolic changes that may lead to diabetes. Another early symptom that may appear is unexpected weight loss. This sign is more commonly associated with type 1 diabetes, but it can sometimes occur in type 2 diabetes as well. When cells cannot access glucose for energy, the body begins searching for alternative sources of fuel. One of the ways it does this is by breaking down stored fat and muscle tissue. As a result, people may lose weight even if their eating habits have not changed. This weight loss may occur quickly and without a clear explanation. While weight loss is often viewed as a positive change, unexplained weight loss should always be evaluated carefully. especially if it occurs alongside other symptoms. Another early sign that may appear is increased hunger after eating. Normally, when we eat a meal, blood sugar levels rise and insulin helps move glucose into the cells. This process signals the brain that the body has received energy and reduces the sensation of hunger. However, when insulin resistance develops, glucose cannot enter cells efficiently. Even though sugar remains in the bloodstream, the cells themselves are essentially starving for energy. As a result, the brain sends signals that trigger hunger shortly after meals. People may feel the urge to eat again, even though they have recently finished eating. This cycle can contribute to overeating and further increases in blood sugar levels. When we look at all of these symptoms together, a clear pattern begins to appear. Diabetes rarely develops suddenly. Instead, the body often sends warning signals long before blood sugar levels become dangerously high. Frequent urination, excessive thirst, fatigue, blurred vision, slow wound healing, frequent infections, tingling in the hands and feet, darkened skin patches, unexplained weight loss, and persistent hunger can all serve as early indicators. The challenge is that many of these symptoms appear mild or unrelated. People often assume they are experiencing stress, dehydration, aging, or temporary illness. However, recognizing these signals can help people become more aware of their health. The earlier diabetes is detected, the greater the opportunity to manage blood sugar levels and reduce the risk of long-term complications. Healthy lifestyle habits can play an important role in supporting metabolic health. Balanced nutrition, regular physical activity, maintaining a healthy body weight, and monitoring blood sugar levels when recommended can all help support long-term health. The body is constantly sending signals about what is happening internally. Learning to recognize those signals can help you respond before small problems develop into serious health conditions. If you found this information helpful, stay with our channel. We regularly explore the warning signs the body may send before serious conditions develop and explain how everyday habits influence long-term health. In the next video, we will discuss another important topic many people overlook: the foods that may help stabilize blood sugar levels naturally. Make sure to stay with us so you don't miss it.